When I started training as a clinical psychologist, I knew that I was interested in this area of sexual problems for people because I had seen through knowledge of the clinical arena in medicine that there were a number of problems that came up for people with medical problems. And I looked at women who had low desire by and large, but I realised as I was talking to these women that it was not just about them, it was about what their partners said about it or the fact that they did or didn't want interactions with their partners that caused these problems. And that sort of set the theme, if you like, for just about, but not quite all of the studies I've done since, which have looked at couples and the various sexual problems that they might have, or if they have a medical condition that sexual problems arise from. Desire problems, for instance, are sometimes generated by medical conditions, and this has been one study that we've done where men with low desire due to their low levels of sex hormones have been followed while they've been treated. And not only have we followed the men, we've followed their partners and contrasted them with a control group of couples who were functioning normally to see just how much of a difference it made to the men's desire to have their testosterone levels changed back from abnormal low levels through to the normal range. And that study was very rewarding in the sense that it showed us for the first time that the desire measures that we as psychologists use actually measure the changes in desire that medical interventions put in place when men are treated for low desire. And on the arousal front, which is sort of the next phase, if you like, of sexual behaviour, we've had quite a large study going in the Waikato that was a world first because it looked for the first time at what women thought about the new erectile dysfunction medications that are out there for men who have problems with their erections. Sex research in New Zealand has largely been about sexual health and infections and condom use and chlamydia and things like that. Sex research, when it's about sexual activity, sexual behaviour, is much less common, and to my knowledge I'm the only person who's doing that kind of research in this particular area. Most of my sort of peer support comes from overseas, and yeah, the work is interesting from that perspective. It's good to know that when we do a study on New Zealand couples that we find similar things there that are reported about overseas populations as well. So we're not so different.